According to United Nations Children Fund UNICEF, nearly half of all deaths in children under the age of 5 are attributable to undernutrition. This translates into the loss of about 3 million young lives annually worldwide. Undernutrition puts children at greater risk of dying from common infections, increases the frequency and severity of such infections, and contributes to delayed recovery. From a global perspective, Nigeria also has its own share of malnutrition, with about 2.5 million malnourished children nationwide. Recent reports by Bureau of Statistics (NBS), UNICEF, and other key stakeholders revealed that malnutrition among children under 5 has increased nationwide, with the highest concerns in northern states. According to the report, child wasting, that is, children who are too thin for their age, increased from 24.2% to 31.5%, while child stunting, that is, children who are too short for their age, increased from 34.8% to 43.6%. There are regional and social disparities to this trend, with particular high levels of stunting in the northeast and northwest parts of the country. Kaduna State is not left out of the malnutrition challenge. In 2016, a meeting between Kaduna State government and officials from UNICEF revealed that large populations of children under the age of 5 are malnourished. Indeed, a test run in 2 local governments of Zaria and Magarfi exposed the depth of tragedy waiting to snuff out lives of Kaduna State innocent children. The Nasir Ahmed El-Rufai-led administration took the bull by the horns at tackling malnutrition in the state. The governor created and inaugurated Kaduna State Emergency Nutrition Action Plan, KADINAP, chaired by Her Excellency Aisha Ummi Garba El-Rufai. Statistics from Federal Ministry of Health in June 2017 revealed that about 263,495 children are acutely malnourished in Kaduna State. Another 248,394 children are mildly malnourished, with a prevalence rate of severely malnourished children of 8.1%.
You see children that you otherwise would probably think a movie is being shown to you. Maybe, last time I saw children like that was when I was looking at clips from Somalia. You know, those highly inflicted areas. But it's right here in our midst, it's in our backyards. And it could be, those children could be my children, could be my sister's children, could be anybody's children, could have been me. It's hard to believe that they've been existing for this long, you know. So, of course, as a mother, my heart bled. It's part of why I decided, when I showed the pictures to my husband, he was not able to sleep as a father. So you can imagine what I would feel as a mother with children. It's heart-wrenching. It's something that anybody, even if you're not a mother, if you've got humanity in your soul, it's something you'd want to do whatever you can to help in any way.
So, the need for an urgent and quick action to nip this trend in the bud became necessary. KADINAP has as term of reference 12 defined functions to quickly intervene. These include to be the apex body in nutrition intervention in the state, to seek partnership at all levels and mobilize resources and technical expertise to fight malnutrition in the state, to spearhead the fight against malnutrition through coordination of already existing structures in collaboration with other MDAs, to engage development partners and other stakeholders in areas of recruitment, training, capacity building, as well as technical support to improve the nutrition status of women and children, to seek for supplies from international and local organizations to support malnourished women and children in the state, to advocate at high level for program intervention with the purpose of leveraging resources for full-scale nutrition intervention, to urgently intervene in any emergency malnutrition situation in the state, to deploy massive media campaign for awareness, sensitization and other publicity programs on nutrition and the consequences of malnutrition, to encourage community and homegrown foods towards women and youth empowerment for sustainable development, to monitor the procurement, supply and distribution of nutrition supplies in the state, to scale up nutrition intervention including all forms of acute malnutrition (AM), severe acute malnutrition (SAM), community management of acute malnutrition (CMAM), infant and young child feeding (IYCF). Kaduna State Emergency Nutrition Action Plan Committee swung into action by taking a holistic and multifaceted approach to tackle nutrition in the state. All the ministries, departments and agencies of government with relevance to the nutrition were brought on board to drive home the objective of the project, which is fighting malnutrition.
A lot of the causes of malnutrition also have to do with education. A lot of it also has to do with supply chain, logistics, delivering commodities. A lot of it has to do with water supply. A lot of it has to do with advocacy and information. And so we're working within the state government across all ministries.
The Kaduna State Primary Healthcare Development Agency is one body that is central to reaching parents and malnourished children across the state. Kadinap, in partnering with the agency, is able to use primary healthcare centers as well as mobilizing health workers in the fight against malnutrition.
The role of the agency in Kadinap is that we provide the structures, we provide for Kadinap to use as a platform to be able to go into the emergency mode to make an improvement in the nutritional status of children in Kaduna. So it's a kind of symbiotic relationship. We're all gaining from one another. We provide the structures, Kaduna provides us with that push.
One of the far-reaching interventions made by Kadinap since inception is the procurement and provision of RUTF, that is, ready-to-use therapeutic food, a vitamin and mineral fortified peanut paste mixed with milk products. It is regarded by doctors globally as a miracle cure for children suffering from severe acute malnutrition.
The requirement for the dispensation of RUTF is that a child has to complete treatment of taking this medicine. It is actually medicine. It might look like food, but it is medicine that is infused with highly concentrated, nutritious things in it. So one of the major requirements is that a child has to take this medicine for at least 8 weeks for you to be able to complete the treatment and for the child to get better, to be saved from, the stage of dying.
Kadinap, through its community management of acute malnutrition (CMAM), has earmarked primary healthcare centers at various local government areas where parents and malnourished children come to access the RUTF.
It is not the number of local government that we cover that is important. What is important is the number of cases you have attended to. We have covered over 6,000 children, though we have some cases of defaulters. Some after going through the program, in the midst of the program, they default. We have set up a system and a mechanism now to trace those defaulters. Why are they defaulting?
At different primary healthcare centers, women are seen in hundreds with their malnourished children coming for treatment as well as RUTF. Stories from the healthcare centers of these malnourished children will certainly interest you as it emotionalizes your thinking.
Akwai ci gaba sosai fa da ya kamata kuma ba abin da kake ji ko ina ka zaga sai dai godiya akan wannan program da Allah ya kawo shi na Kannywood. Wannan abin da ake bada kyauta ne ba kuɗi yake karba ba. Hatta gwamnati ta yi kokari ta bada mota da ake ɗauko mutane daga makarfi zuwa nan duk kyauta ne. Akwai lokacin da ita mata gwamna ta zo makarfi ta gani har tana kuka sakamakon yanayin yadda ta ga yara. Za ga yaro an kawo shi a lokacin ma za ka iya cewa yaron ma ba za a wani zai ɗauke shi ba. Amma yanzu ya kai ga abun sha'awa sai godiya hakika ba abin da za mu ce wannan abu sai godiya tsakaninmu da ita wannan gwamnati da take wannan abu.
This is Amina Joro, a 2-year-old girl living in Rugam Fulani, Paraguay, under the care of her parents. She is full of health, energy. On this good bright morning, Amina is enjoying the weather and company of her parents. 5 months ago, Amina was on the verge of death. She was truly sick. Her mother, Hajo, brought her to Paraguay Primary Healthcare Center.
Kahin su fara zuwa asibiti. Wannan bai Allah dai Amina ta sha wahalhalu da dama. An je asibiti ta cikin Zaria da ita. An shi na gargajiya. Duka ba a samu wani sauki ba.
Satin mu 8. In aka ba mu wannan abinci sai ce mu wanke mata hannuwa, in wanke hannuna, in wanke mata fuskar ta sannan in bata.
Amina was adequately tested and confirmed to be acutely malnourished. Through the intervention of Kadinap, Amina was placed on observation and provided with ready-to-use therapeutic food, RUTF. This is Amina, 3 weeks later, fast regaining her body and strength. 6 weeks down the treatment, Amina has gained full fitness and is playing around like every other child her age.
Alhamdulillah, mu wanda ashe kuɗin mu ba tambaye mu ko sisi ba. Ana dai ne a kan kyauta. Kuma mun gode mu gwamnati. Wannan gwamnati ta dai taimaka mana mu talakanta. Ba ashe komai gare mu ba.
Even with the provision of RUTF and other medical commodities, many of the malnourished children still don't have access to the medication. The reason is not far-fetched. The parents are so poor and cannot afford to take them to the health facility. However, Kadinap, in collaboration with the State Transport Service, that is Kaduna State Transport Authority KSTA, arranged for a transport scheme that will take parents, especially those in the rural areas, to the health facilities closest to them.
Wacce za ta hau mota ba ta da kuɗin da za ta iya zuwa wajen wannan karɓar magani. Amma suna farin ciki da wannan gwamnati ta ba da wannan mota kyauta. Ana zuwa ana ɗaukar suna jin daɗi, suna godiya, in sun sauka suna gode mana suna shi mana albarka.
In Zaria local government, for example, children from as far as rural areas in Pambegwa are transported to primary healthcare centers in Zaria to access the RUTF.
Ko talakawa in su ba su da kuɗin mota da za su ɗauka ko in sun ɗauko daga can to dan wannan abun da ake musu daga nan zuwa can wurin asibitin din suna jin daɗi zaka ji suna mana godiya. Akwai na Soba, akwai na Fambeguwa, duk muka nan ɗauko su na wurare wanda yake sukan zo wurin din su zo su karɓi magani su koma.
So far, Kadinap's intervention on malnutrition and malnourished children has had a positive impact in Kaduna State. Available data as at November 2017 has shown that Kadinap has impacted in no small measure to salvaging the lives of thousands of children in Kaduna State.
A lokacin kafin na fara kawo shi baya wasa sosai kuma fatan yayi tauri kuma wani lokacin yana yawan zazzabi. Amma tunda na fara kawo shi gaskiya ya samu lafiya ko da ganin alama fatan ya canza. Ba ma biyan kuɗi. Mun gode Ubangiji Allah ya saka da alheri, Ubangiji Allah kuma ya ba su hikima akan aikin da suke yi, Allah ya sa su rike da aminci.
Sati na 7 ina zuwa. Alhamdulillah gaskiya mun gode wa Allah mun ga canji sosai.
The statistical data between January to November 2017 goes as follows. Zaria local government. Number of malnourished admitted is 5,580 and about 4,823 were treated successfully, representing 94.7%. Makarfi local government, 4,296 were admitted and about 2,374 were treated and discharged, representing 81.7%. Igabi local government admitted 3,377 malnourished and over 1,141 were treated successfully, representing 63.9%. Birnungwari local government received about 553 cases of malnourished children and 226 were also treated, that is 78%. Kafanchan, 244 cases and 77 of the children were treated successfully and discharged, representing 63.6%. Kachia, 189 cases received and 90 of them were treated, representing 48.6%. Kaduna South local government recorded 224 and about 102 were treated. In all, about 14,909 cases of acute malnutrition was recorded across the state, out of which 8,990 were treated and cured, representing 84.1%. About 1,225, representing 11.5%, defaulted, and 151, representing 1.4%, sadly died.
Lives of many children have been saved because the child that is wasted is 10 times likely to die. If you see that child, if you don't take any step, that child may not survive to see tomorrow. But with this step that cardinals have taken, lives and hundreds of children have been saved that could have been dead by now.
Public enlightenment has a huge role to play in fighting malnutrition. With this in mind, Kadinap began enlightenment campaigns on different platforms: radio, television, social and print media. On social media, Kadinap has accounts on Facebook, Twitter and Instagram. This is to ensure ceaseless, cheap and fast dissemination of information on the activities of Kadinap on how to prevent malnutrition.
We are engaging the media to continue on a daily basis through jingles, through dramas, through role plays, to tell the public that malnutrition is a disease that can be combated. To also tell them that ready-to-eat repeat food is free of charge. It has been paid for by Kaduna State government. Anywhere you see it being sold by somebody, that person should be reported to the nearest police station or to the nearest stakeholder around. We have succeeded in creating very, very large group of people that have become champions of advocating to this in Kaduna State.
Kadinap committee members, led by the chairperson, Hajia Aisha Ummi El-Rufai, embarked on a tour to the media houses in Kaduna metropolis. The aim of this tour was to sensitize and solicit for support in the fight against malnutrition. To keep in touch with the people at the grassroots and sensitize them on the day-to-day practices that promote malnutrition in our societies, Kadinap organizes town hall meetings periodically for stakeholders in different local government areas of the state. Kadinap is definitely moving in the right direction in terms of fighting malnutrition in Kaduna State. But the journey is not yet over. Access to proper medical attention needs to be created through scaling up of existing PHCs. Healthcare practitioners need to be properly trained on malnutrition treatment. Spreading more enlightenment and awareness campaigns all across the state on the dangers of malnutrition. For all these to happen, all hands must be on deck. Stakeholders and development partners must join hands to support this cause in a bid to safeguard the future generation of our dear state and country at large.
By the time we're done, our people, each and every member of our community, would be able to understand the causes, the risks, the effects, and the solutions to malnutrition. And we by then would have sustainably and holistically tackled malnutrition to a point that our people already adopt a certain way of life and understand what they need to do or not do that can get them out of malnutrition.
We have tried as much as possible to do it from the beginning of the Kadinap design, is to ensure that it can go beyond this administration. And we have done this by ensuring that it is the agencies that are responsible for doing this work that are still doing them. CADINAP is a coordination platform, but really the members of CADINAP are the staff and the commissioners of the various ministries. So for example, wherever we have a water and sanitation issue, it is the Ministry of Water Resources that deals with that. Whenever we have an issue with any of the CMAM sites, it is the Ministry of Health or the State Primary Healthcare Agency that deals with it. Whenever we're talking about financing, it is the Ministry of Finance and myself, the Ministry of Budget and Planning, that deal with it. So all these people and their staff will be there beyond when we are gone. So as much as possible, the interventions are driven through government. CADINAP is not another separate accounting body that is implementing projects.